So this week, Elmo and Charlie came into the clinic with me, and Elmo had an ear infection and Charlie had his teeth cleaned. So I've made it into a video blog for you guys to watch. Okay, so today is a big day for Charlie. He's excited, but he doesn't know it. He's coming to the clinic to have his teeth cleaned today. And Elmo, I believe Elmo has an ear infection, so he's also coming in. Hey. Okay, so now Elmo is he's just had his Prozac, and I'm hiding his clonidine in here because he's going to get really scared at the clinic, so he needs lots of drugs.
And he has an ear infection.
Okay, so Charlie doesn't get to have his tablet in peanut butter. He's going to have it. He's just going to get killed. Oi, come here.
And he's getting his teeth cleaned today.
Yes, he's getting his teeth. Okay, so we've arrived at work. Charlie and Elmo are hanging out together. You can see Elmo's pretty nervous. Lots of lipping there. Lip licking? Yes. And Charlie, I'm giving you a pep talk. You got to sit still for bloods. Okay, Charlie is up on the table. It's his turn to have a dental. Hey, oh, you poor boy. Hey, he's got his catheter in, and his blood test was nice and normal as well. Okay, so we've worked out where to put the phone so that we can film Charlie's induction. So this is the induction agent. It makes him go from awake to asleep. It's called Alfaxan, and I give it slow IV. Alright, now we just play the waiting game and see him gently go to sleep. Good boy. Boy. Okay, so hopefully he's asleep enough that I can now intubate him. Just get that way a bit. Beautiful. Boy. Perfect. So he's been intubated. Alright, so now we are hooking him up to oxygen and also some monitoring equipment and some isoflurane, which is an anaesthetic drug that keeps him asleep. Boy. And he'll be going on fluids. Okay, so he's asleep. We've got some monitoring equipment on. We're going to hook him up to some IV fluids. He's breathing. We're going to put some lube in his eyes to keep his eyes from drying out when he's asleep under the anaesthetic. And I'm going to clean his teeth. Okay, so looking in Charlie's mouth, we can see that he does have some gingivitis as well as quite thick tartar on some of his back molars. This is the first time I'm getting a really good look at his teeth because everyone who knows Charlie knows he wriggles a lot. Okay, I just had nursing student Laura put some lube in Charlie's eyes for me, and nurse Natalia just hooked him up to IV fluids, and you can see we have the pulse ox, and we will be having blood pressure on him later as well with our Cardell monitor up there. Okay, I've got my scaler. I'm going to start cleaning his teeth. Actually, I'm going to put gloves on first because that's a bit gross really. Smear. Oh, you have gloves? I got gloves. Just didn't put them on. Okay, take 2 at the scaling his teeth. So we use an ultrasonic scaler. I'm just going to clean, turn the light on for myself. There we go. Just going to clean his teeth. Good boy. Okay, so I've just put this pink stuff on Charlie's teeth, which is called plaque disclosing solution. So basically what it does is if I've missed any area of his teeth when I've been scaling, it will highlight it pink, and I go back over it with the scaler and clean. So you can see around on his canine tooth there's a couple of areas that have highlighted pink, and so the plaque disclosing solution is doing what it needs to do, and I'm going to go back over and scale any areas that I missed. Okay, so I have polished Charlie's teeth, so we use the polisher and some polishing paste. So his teeth have been cleaned. Now I am rinsing his mouth out, and then we'll roll him over and do the same on the other side. Okay, so he's been rolled over, and I'm about to start the exact same thing again. I've got Natalia trimming Charlie's nails because let's take advantage of this anaesthetic. And I'm going to check his ears as well while he's asleep. And we'll do that after his teeth are finished being cleaned. Oh, look at these pretty white teeth. He's now got a beautiful Hollywood smile. He just needs to kind of have his face washed now to match it. Charlie has his little glam squad working on him. We've got Laura cleaning his ears and Nat cleaning up his face. What a lucky boy. So he's now turned off the anaesthetic gas and he's just on oxygen. So as he breathes off the anaesthetic gas, he will wake back up. And we've also taken down the cuff in his ET tube so that we can pull it out nice and easily once he's awake. Alrighty, so he started swallowing, so we removed his ET tube and he's all curled up in his blankets. Hey, and he's still getting glammed up. He looks a wreck. Somebody is feeling very sore and sorry for himself. You hear him? Poor baby. So Mostie's let me cuddle him because he's half drugged. Look who's awake. I think you might be ready to go back in with your brother. What do you reckon? Elmo's hanging out down here. He's wondering where Charlie is. Where's your brother? Where's your brother? Here he is.